The days of going under the knife are quickly becoming a thing of the past. They used to have to slice people open from stem to sternum, as they say. But nowadays, simple and really even complex surgeries are successfully conducted through incisions as small as 0.5 centimeter. In fact, the incisions are so small that the procedures are nicknamed keyhole surgeries or Band-Aid surgeries. But technically, we call them laparoscopic surgeries.
Laparoscopic surgery is another name for minimally invasive surgery. And the difference between full-blown laparotomy and laparoscopy is that laparotomy requires usually a fairly large incision in the abdomen. Laparoscopy, or minimally invasive surgery of the abdomen, allows us to do the same surgeries we would do through a laparotomy, but through much smaller incisions. In my particular practice, which is limited to colon and rectal surgical issues, I'd say at least 80 to 85% of my abdominal surgery is at least started laparoscopically.
When performing these operations, surgeons manipulate surgical tools with a handheld controller, similar to those used for video games, and they watch the action on a television screen located away from the patient. But that doesn't mean that anyone with their own copy of Staying Alive, Arduous Surgeries, Volume 2 makes them a qualified laparoscopic surgeon. It's a technically complex surgical approach, and surgeons must complete a 1 to 2 year fellowship training in laparoscopy, in addition to their basic surgical residency. And they don't do laparoscopic surgery just anywhere in the abdomen. They specialize, such as in liver and gallbladder surgery, or vascular surgery, or colon surgery.
Most of the laparoscopic colon surgery is now done in what we call a hand-assisted laparoscopic fashion. An approximately 2 to 2.5 inch incision at the level of the umbilicus or belly button is created. And through that incision we place the equivalent of like a rubber dam. And what this allows us to do is something called insufflation, or we inject carbon dioxide into the intra-abdominal cavity, which elevates the abdominal wall up off the organs, somewhat like blowing up a balloon. And it gives you room to work inside the abdomen. Then in 2 or 3 other places in the abdomen, we make incisions that are usually about 1/2 to 3/4 of an inch long, through which we place a tube called a trocar. And through these trocars, we place a camera which projects a high-definition image onto 3 or 4 screens in the operating room. And through the other trocars or ports, we place our instruments, which allow us to do things like cut and sew and staple.
Medically, there are a lot of advantages. There's reduced hemorrhaging, which reduces the likelihood of needing a blood transfusion, and there's less post-operative scarring. And since we're going into the body rather than opening the body up, there's reduced exposure of the internal organs and a reduced risk of infection. Then there are the benefits the patients feel.
Since you're operating through smaller incisions, most of the time there's less discomfort after surgery. Most of the time, but not all the time, most of the time patients leave the hospital a little sooner. In our practice, probably 1 to 2 days earlier than they would if they had a laparotomy. But most importantly, we see that patients return to their normal life much more quickly because of the pain issues, because of the healing process, patients seem to bounce back a lot more quickly. So whereas with a laparotomy, it may take 6, 8 weeks or even more to get back to work, we've seen patients sometimes after 2 or 3 weeks after the same operation done with the minimally invasive approach, get back to work, get back to their normal life.
I mean, all in all, you're gonna feel pretty good. Perhaps the only disadvantage of laparoscopic surgery is that it's hard to drum up sympathy for your major surgery when all you have are a few tiny little scars. It's worth the trade-off. I'm Dr. Keller Wortham, and you're watching the eHealth Network. See you next time.